Hydrocortisone, a familiar name in critical care, often whispered with a mix of hope and apprehension. For years, it has held a place in the management of severe pneumonia, a beacon of potential benefit in the storm of a life-threatening infection. Yet, the evidence supporting its use has remained stubbornly equivocal, a tapestry woven with threads of uncertainty. Clinicians, armed with experience and driven by compassion, have often found themselves at a crossroads. Should they administer hydrocortisone, hoping to dampen the inflammatory firestorm raging within their patient's lungs? Or should they hold back, wary of the potential harms that accompany steroid use? This dilemma, etched into the minds of critical care physicians worldwide, set the stage for the REMAP-CAP trial, a landmark study designed to shed light on the murky waters of hydrocortisone use in severe pneumonia. The year is 2025. The world has witnessed a rapid evolution in medical science, yet some questions refuse to be silenced. The REMAP-CAP trial emerged from this backdrop, a testament to the relentless pursuit of evidence in an era of evolving medical practice. Its core objective was deceptively simple, yet profoundly significant: to determine whether the routine administration of hydrocortisone in patients with severe community-acquired pneumonia truly improves outcomes. This was not merely an academic pursuit, it was a question with real-world implications, a question that resonated in intensive care units where every decision carries the weight of a life hanging in the balance. The trial sought to provide clarity, to equip clinicians with the evidence they needed to make informed decisions for their patients battling severe pneumonia. The REMAP-CAP trial, a pragmatic study reflecting the realities of clinical practice, enrolled adults hospitalized with severe community-acquired pneumonia. These were not patients with mild cases. These were individuals battling a severe infectious assault on their respiratory system, often requiring intensive care. The trial employed a two-armed approach. One group received intravenous hydrocortisone alongside standard care, the cornerstone of their treatment. The other group, serving as a comparison point, received only standard care, their treatment mirroring the established practices for severe pneumonia. A key aspect of the trial's design was its open-label nature. This meant that both the clinicians and the patients were aware of whether hydrocortisone was being administered. While this approach increased the risk of bias, it reflected the practical challenges of studying a readily identifiable intervention like hydrocortisone in a real-world setting. As the trial unfolded, clinicians and researchers around the world watched with bated breath, eager to unravel the enigma of hydrocortisone in severe pneumonia. The primary endpoint, the measure by which the treatment's success would be judged, was stark in its simplicity: mortality at day 90. The results, when they emerged, were sobering. The group receiving hydrocortisone, the group carrying the hopes of a potential breakthrough, did not fare better than the group receiving standard care alone. In fact, the mortality rate in the hydrocortisone group was numerically higher, although this difference did not reach statistical significance. This lack of a statistically significant difference, while not a definitive answer, cast a long shadow of doubt over the routine use of hydrocortisone in severe pneumonia. It was a signal, a suggestion that perhaps the perceived benefits of this common practice were not as robust as once believed. Despite the sobering findings, the REMAP-CAP trial was not a failure. In fact, it stands as a testament to rigorous research methodology and a commitment to improving patient outcomes. Its strengths lie not only in its design but also in its execution and its broader implications. Firstly, the trial's international scope is noteworthy. Conducted across multiple countries and healthcare systems, it captured the diversity of real-world clinical practice, enhancing the generalizability of its findings. This broad reach makes the results more applicable to a wider range of patients and clinical settings. Secondly, the trial's use of adaptive Bayesian modeling deserves recognition. This sophisticated statistical approach allowed for ongoing analysis of data and adjustments to the trial design, optimizing efficiency and ensuring that the study remained aligned with evolving scientific understanding. Finally, the trial's pragmatic design, mirroring the complexities of real-world clinical practice, enhances its external validity. The findings are directly applicable to the patients clinicians encounter daily, providing valuable insights to guide treatment decisions at the bedside. Section 6. Limitations and lingering questions, unblinding the biases. While the REMAP-CAP trial boasts several strengths, it is not without limitations. These limitations, inherent in its design and conduct, must be acknowledged to ensure a balanced interpretation of its findings. The most notable limitation is the lack of blinding. As an open-label study, both clinicians and patients were aware of the treatment allocation. This lack of blinding introduces the potential for bias, as clinicians' expectations and patients' perceptions could have influenced treatment decisions and outcomes. Another limitation is the relatively small size of the control group compared to the intervention group. While this discrepancy is not uncommon in pragmatic trials, it can limit the statistical power of the study, potentially masking subtle but clinically relevant differences between the groups. Finally, it is crucial to acknowledge the possibility of missed benefits for specific subgroups of patients with severe pneumonia. While the trial did not demonstrate an overall benefit for hydrocortisone, it is conceivable that certain patient populations, such as those with refractory septic shock, might still derive benefit from this treatment. Further research is needed to explore this possibility. Section 7. Navigating the Gray Areas. Practical implications for clinicians. The REMAP-CAP trial, despite its limitations, provides valuable insights for clinicians navigating the complexities of severe pneumonia management. While it does not offer definitive answers, it does illuminate the path forward, guiding clinical decision-making in the face of uncertainty. The trial's findings suggest that the routine use of hydrocortisone in all patients with severe pneumonia may not be warranted. The lack of a clear mortality benefit, coupled with the potential for harm, calls into question the previously held assumptions about the universal efficacy of this intervention. However, the trial does not preclude the use of hydrocortisone in specific clinical scenarios. In patients with severe pneumonia complicated by refractory septic shock, where the benefits of reducing inflammation might outweigh the risks, hydrocortisone may still be considered. Clinicians must carefully weigh the potential benefits and risks of hydrocortisone on a case-by-case basis. Patient factors such as comorbidities, disease severity, and response to initial therapy should be considered when making treatment decisions. Section 8. Shaping the Future Implications for Research and Practice. The REMAP-CAP trial, while not the final word on hydrocortisone in severe pneumonia, has undoubtedly shifted the landscape of clinical practice and research. Its findings, disseminated through publications and conferences, are sparking debate and prompting a reassessment of long-held beliefs. The trial's emphasis on pragmatic design and real-world applicability is influencing the way future research is conducted. It highlights the importance of studying interventions in settings that mirror clinical practice, ensuring that findings are relevant and translatable to the bedside. Moreover, the trial's use of advanced statistical methods, such as Bayesian modeling, is paving the way for more efficient and informative clinical trials. These methods, once considered novel, are becoming increasingly commonplace, enhancing the rigor and responsiveness of medical research. The REMAP-CAP trial serves as a reminder that medical knowledge is constantly evolving. It underscores the importance of questioning assumptions, embracing uncertainty, and continually seeking evidence to refine and improve patient care. Section 9. A Call to Reflection. Sharing Experiences and Shaping the Future. The findings of the REMAP-CAP trial invite reflection and discussion among clinicians involved in the care of patients with severe pneumonia. It is through shared experiences, thoughtful analysis, and open dialogue that we can collectively translate research findings into improved patient outcomes. Have you observed changes in your own practice or the practices of your colleagues regarding the use of hydrocortisone in severe pneumonia since the publication of the REMAP-CAP trial? Have these changes been driven by the trial's findings, or have other factors such as local guidelines or individual patient characteristics played a more significant role? Sharing your experiences, insights, and perspectives can enrich our collective understanding of this complex issue. By engaging in open and honest dialogue, we can learn from one another, refine our clinical practices, and ultimately provide the best possible care for our patients battling severe pneumonia.